if one is going to be non-directive, person-centered, is just, in a sense, to hold a space, create a space where the client can express themselves, be more of who they are.
It's nice to be back here with you, and just to go and recap, just to have a look at what we discussed the previous time. So in our previous episode, what we had a look at is really about when what is the indications of when to become directive, and then when should the therapist be non-directive again. So just very shortly, what we looked at is being when a client needs a skill, or they need knowledge, or they need feedback. That is when a therapist can come in as being more directive and assisting and showing the client and giving feedback. And then once that's done, then for the therapist to step back again and into the non-directive approach, and to assist them to become empowered and to work with that feedback.
I couldn't have said it better. You've got it.
Got it. Okay. Okay. So today, what I thought to really look at is really going more into the person-centered, and understanding that a bit more, and really looking at the practical side, how to do person-centered therapy, and then and now I'm jumping later on that
Yes.
we look at why and what's the reasons for it. Yeah.
What you've focused on here is just so important, because it's one thing to know about person-centered therapy, but how do you actually do it? How can you be person-centered? So it's very practical. Love it. So let's go.
Okay. Let's
Yeah.
do. Okay.
So the main consideration here is just, in a person-centered approach, is just the three aspects. It's just being really congruent and authentic as a therapist, just trying to understand accurately and doing so without judgment. So, yeah, I suppose where we should just look at to begin with is just say how to kick off a session.
Okay.
So, in kicking off a session, if one is going to be non-directive, person-centered, is just, in a sense, to hold a space, create a space where the client can express themselves, be more of who they are. And one can do that in a way by just holding that space, but particularly by just giving, if someone wants to start talking, let them just talk.
Okay.
If they're waiting for you as therapist to take the lead, one can take the lead in a very open-ended way. I think I've said before, someone who I value greatly, a colleague and friend, Alda De Wet, Dr. Alda De Wet, had utilized just saying, "Where do I find you?" What an open-ended question, which immediately gives it over to the client. So, where do I find you? Or where would you like to start? Or would you like to start? But saying it, would you like to start? So just giving over. Or would you like to share what's on your mind? So anything that's really open-ended and giving over to the client.
It's really invitational and going with them. So there's no pressure. It's an invitation.
Yeah, beautiful. Yeah, it is really invitational. If by contrast, say, how was your drive here? Did you find the place easy enough? Do you like our center? uh, all of these are very direct questions. And again, as therapists, one's becoming directive here, very visible. It's not wrong or right, but the main thing is one's actually getting in the client's way. And by just being non-directive, just giving over by invitation, the client can just begin expressing and sharing their experience.
And that in itself, it gives them room already to share what they want to share with and where they are at that moment.
Yes, very much. Part of what you've just said is so important, because we can't know where another is at. And we can't know that immediately, and we can never really know it fully. We can never entirely be someone else. We can never know exactly the experience. But to the extent that we listen actively and in a way where we, by invitation, give over to them to be able to express, talk, whatever that is, they can punctuate in their experience and begin expressing and giving full expression to that. So it's that sense of, by invitation, giving it over, and the client can then really punctuate. And then it's for the therapist to listen as actively as one can, trying to understand something of the client's experience.
Seeing them and being on the journey with them.
Yes. Yeah, very much, because it's their journey, and it's about what is meaningful for them, and it's being on that journey with them, and in a sense holding space, so that they can give expression and begin to talk about what's on their mind, where they're at, what's happening, what would they like help with, what are the challenges, whatever it is. It's them and it's their journey, and we literally or figuratively journey with them that part.
Yes, where they need to go and what their journey is actually.
Yes.
It is, yes.
Yeah, very much.
I'm thinking about that now as well as, and with my experience with clients, not always, but sometimes as well, is some clients just they don't know. So it's sometimes hard for them
Yes.
when it is so person-centered. So I'm just wondering what your thoughts on that and how to assist a client with that.
For many clients, they expect to be directed, and again, that's not wrong or right. And so it can be a little surprising or unexpected, because many clients will expect what's going to happen is something social. How are you doing today? What do you make of the weather? Any number of social exchanges. And it's not wrong or right, but to the extent you're in a social exchange, again, you're in a social definition, and a client tends to comply, respond, and there's something of a social dance, but that really doesn't bring visibility for the client and their experience. So to a large extent, we just want to stand out the way, create a space, hold a space, and be out of the way. And if you give over to a client by way of invitation, they just very often will begin expressing something of their experience. And there is some discomfort for a client, and very often a therapist may want to try and manage it socially, but it just usually becomes something of a social, if not a incongruent dance that's going on. It doesn't actually hold a space where the client can more safely begin to express how they're feeling, what their experience is. So if you just stand out the way, but are just holding that space, giving it over by invitation, quickly the client gives expression to something of their experience. And what's amazing is that we often actually don't know what we're feeling. We think we do, and sometimes we do, but not always. So it's through our interaction and through talking that we often come to understand ourselves more clearly, and especially within a context of a relationship where it's trustworthy, it's congruent, you can trust it, there's accurate understanding and no judgment, that as I express to you, I'm feeling, or if the client expresses, and one accurately understands their experience and reflects them back to them. In that moment, they now come to understand something of their experience, actually clarifying. So in this process of giving it over and hearing them and trying to listen as accurately as possible and giving it back to them, which helps to confirm their experience, it also clarifies it.
Okay, and for them as well, and they can understand themselves better.
Yes, yes. When there's been a really meaningful encounter. I don't know if you've experienced this in your life, where someone really listens to you without judgment, and they understand as fully as they can. They give it back to you. It can be quite like enlightening, or just, oh wow, that's it. One is saying it, but without knowing it or being able to recognize it, and how meaningful that can be.
I go with you, that's so spot on. And I just, in the moment you said it, I just reflected on the mentorship sessions that I have with you, and how that just utilizes it and it brings it forward. And it brings so much clarity and so much understanding with that. So yes, it's definitely that experience.
I
Yes.
appreciate that. And for me, the opportunity of being able to, along the way, work and be a mentor is in itself deeply meaningful. It's also clarifying. So it is for me very meaningful too.
It's all about the relationship and relating and doing it together, and really stepping into the client's world and journeying with them, and in that journey assisting them with clarifications and understanding themselves better.
Yes.
And that brings a lot of empowerment to them.
Very much. Because on that journey with them and their deeper understanding of themselves through the relationship, through the interaction, that is deeply empowering. That's as one self-actualizes. And you've just expressed it so clearly that it's always in the relationship. And that from moment to moment, and I think we've noted this, or that, that quote from Charles Forster, how you relate to me and how I relate to you determines the nature and quality of our being. So it really is our well-being, our wellness has to do with, to a large extent, the nature and quality of our interaction at any given time. And so understanding oneself occurs through relationship. And in a person-centered relationship, there's a very special clarity, a very special and a much deeper understanding one has of oneself.
Sure. This is, I feel like we're touching more and more on the person-centered approach and exploring it so much more. And I know with most psychologists know about it, but it's so meaningful to go into so much depth about it. And I'm looking forward to going even further and looking in more detail and just understanding, going into the understanding even more.
I share that. It is almost like that onion, that just layer after layer.
Yes.
The person-centered approach is so profound that you just look at it and you've got it. Then you look at it again, and it's clearer. And you look at it again, because it's the foundation of any meaningful helping relationship, any meaningful therapeutic process. And we've got so much more to look at. So I'm looking forward to that.
Yes. No, I go with that. I agree with it.